Good afternoon to everyone. I am Gajalakshmi, epidemiologist working in Chennai, South India. I first met Richard Peto in 1994 at the International Cancer Congress in New Delhi. Both of us were speakers in a symposium on clinical trials. And then during lunch break, we were talking about the studies going on in India. And then Richard Peto said, would you like to do studies on tobacco in Tamil Nadu? I said, yes. And then he wanted to know whether I'm interested in case control or cohort studies. I said both. And then I established case control studies in Chennai, one study in Chennai, that is urban area, and another one in Viluppuram with 80,000 adult deaths and 80,000 controls. And third study was on smoking and drinking, that is with living men, 3,000 tuberculosis cases, confirmed cases from the hospitals. And we took population controls living in the same villages. And then I have two cohort studies which are going on now in Tamil Nadu. One in Chennai, that is with 500,000 adults, that is 500,000, age 35 plus. And another one in Viluppuram, that is rural area, with 100,000 adults aged 35 plus. So we did verbal autopsy. Why are we doing verbal autopsy in Tamil Nadu? Because cause of death on the death certificate is unknown or non-specific for about 50% of deaths. So we developed a tool, VA tool, to assign probable underlying cause of death. So this shows the results. We reviewed 80,000 VA reports in 3 years, 1998 to 2000. The result shows we were able to assign cause of death for 90% of deaths in early and middle age and 80% of deaths at all ages. It also reduces deaths from unspecified cause in all ages from 50% to 20%. And we are able to assign the cause when none is reported. So we presented these results to RGI, who is the Registrar General of India, who is the Census Commissioner and in charge of births and deaths for the country. And also to the census directors, they are in charge of collecting deaths for the country. And they were all convinced about the methodology, and RGI has agreed and implemented the methodology for nationwide for 15 plus, because the methodology which I developed is only for 25 plus. So it can be used from 15 plus. So these are the results for the first two case control studies, one in Chennai, another one in Viluppuram, with 80,000 adult deaths and 80,000 controls. So this is urban, this is rural risk ratio, and this is smoking associated, urban and rural. So you can see twofold risk of dying from neoplasm, and this translates to 35% of deaths attributed to smoking. Whereas for tuberculosis, it is fourfold risk, and it translates to 50 to 60% of deaths from tuberculosis is attributed to smoking. We didn't expect this result, and it was a very surprise to us. And then we did the type of smoking and tuberculosis. See, if they smoke cigarette, the risk is threefold. And if they smoke BD, it is sixfold. So 15% of deaths were attributed to BD and 22% in cigarette. In Chennai, among smokers, 75% smoke cigarettes, only 25% smoke BDs. So whatever studies we have done for the past 25 years, only BDs have higher risk than cigarettes. And then in Viluppuram, so risk associated with cigarette is twofold and BD 4.2-fold. And here, 75% of smokers smoke BD and only 25% smoke cigarettes. And third study on smoking and drinking, this is with 3,000 TB cases, confirmed one. The previous study, we have taken the dead people and they got the diagnosis based on verbal autopsy, whereas these are confirmed TB cases. And this shows that 2 to 3-fold risk of developing TB among smokers and 2-fold risk of developing TB among drinkers If they have both the habit, the risk is fourfold. This cohort study. I'm going to show you the results of only Chennai cohort. It is a house survey in Chennai. We started in 1998 and completed in 2001. We have recruited 500,000 adults, that is 500,000 adults, aged 35 plus. It is almost 1/3 of the Chennai population. And we trained university graduates to collect data. And then whatever data coming from the field is garbage. You have to clean it. You have to check for the quality. So we focus on quality control. We checked all form for consistency and completeness. And then we coded the data and entered it twice in the computer to avoid any entry errors. And then we repeated the interview and measurements for about 5% of the outputs. Follow-up. Follow-up, we have two methods. One is active, another one is passive. So in active follow-up, we send our field workers to the houses again to find out whether the person is alive or dead. If dead, they write verbal autopsy report. If alive, they ask, are they suffering from any illness like TB, diabetes, cancer, stroke, asthma, and then they note it down. And for passive follow-up, we are linking our database with the deaths registered in the corporation. But it is not easy task because I am not getting data in the electronic media. So I have to download all the deaths that occur every day. That is about 35,000 deaths per year that we save in the computer. And then we match it with our 500,000 records. Out of 500,000, now 80,000 dead. So we have to match with 420,000 record manually. There is no program. It is impossible to develop a program for our matching because our names are spelled differently, it is written differently. First, sometimes they write last name as a first name as a last name. So it is not possible to match it through programs. And then we resurveyed. After 14 years of initial survey, we interviewed and measured 10,000 men. So SBP in vascular, BMI, and all these are touched upon by Sarah. So highlights, 20 millimeters of mercury, lowering 20 millimeters of mercury, SBP, halves vascular mortality. BMI had little effect on vascular mortality, and low BMI at a given blood pressure was hazardous. In men, both smoking and drinking were associated with substantial excess mortality during middle age. Both smoking and drinking are independent risk factors. Smoking contributes to half the male TB deaths in India at ages 25 to 69. A total deaths is 0.4 million from TB, out of this 0.2 million attributed to smoking. The VA2 developed for Tamil Nadu studies has been adapted and used nationwide for 15 plus by RGI. Thank you.